most famous physical therapist on the internet.
Hi folks, I'm Bob Schultz, physical therapist.
Brad Heine, physical
We're the
therapist.
most famous physical therapists on the internet.
In our opinion, of course,
We're
Bob.
going to show you today how to test for spinal stenosis. We have a 30-second test. We actually have 3 questions you can ask yourself too.
Sure.
Or have somebody ask you if you think that's a little strange talking to yourself. And this can narrow down fairly close if whether or not you have it. Spinal stenosis is also known as basically lumbar or back arthritis. And it's also called degenerative disc disease. That can often lead to it.
Sure.
And so if you're new to our channel, by the way, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. We're always giving away something. We're going to be giving away something tomorrow, starting on Sunday. I think it's the Thermotex, I believe, the infrared system,
Infrared heat pad.
which is really great for spinal stenosis, let me tell you.
Sure.
So you can go to Facebook and you'll find it on there, Bob and Brad. You also go to our website, bobandbrad.com, and go to our giveaway section.
Sure.
So join us there. All right, I want to show just real quickly, Brad, what spinal stenosis is. So basically, stenosis means a narrowing, correct?
So what's narrowing?
Okay.
That's what we're going to look at.
So we got the spine here. The head would be right here. This is the pelvis. You can see part of the legs right here. Got the entire back here. These nerves, you can see, actually come out of little holes right here. We call them foramen. And those holes, with time, with arthritis and with degeneration, as you get older, can get smaller. So there's less room for the nerve to come out.
So if that nerve gets pinched, we've got a problem.
Right. And
Pain.
that'll send the pain down your leg like you normally get with spinal stenosis. Now, what a lot of people don't realize, though, is, and we're going to use this nerve here, the blue one, just as a demonstration, that you can actually change the size of that hole depending what your body position you're in.
Yep. So right there, I've got the pin in that foramen. That there's plenty of room for the nerve and the pin.
If I bend forward, look how that hole gets bigger. Now there's more room for that nerve to work,
Right.
to come out. Now if I bend back, that hole gets smaller.
Right. Now I can hardly get the pin in there, the tip of the pin. Just the mechanics of how the back work with the facet joints and the foramen.
Now if you have a normal healthy back, that doesn't matter. There's plenty of room no matter which direction you go.
Right.
But if you have spinal stenosis, that may pinch. The other thing is if I turn toward the painful side, it actually opens that hole up. If I turn away from the painful side, it actually closes that hole up.
It's probably not as significant as forward and backwards, but it still has an influence on it.
So let's look at that in real life, Brad. So if I have spinal stenosis, what things generally are going to bother me? If I bend backward like this.
Yep.
And if I bend forward or sit,
Right.
that often gives me relief of pain.
Sure.
So let's talk about the 3 questions first.
Okay.
Are you over 55?
Yes.
Okay, so you're over 55. Do you have back pain?
Yes.
Does it increase with standing and walking?
Yes.
Does it get better when you sit?
Yes.
Okay.
And those answers are true for me.
Yeah, and he does have spondylolisthesis and spinal stenosis, right?
Right. They kind of oftentimes overlap.
Work together. There's other thing too. Not only is it better with sitting sometimes, it's also better when you lean on a shopping cart. They call it shopping cart syndrome. And you're pushing a shopping cart because you're bending forward a little bit, opening that hole again.
Right. It doesn't have to be a shopping cart, does it?
No, it could be a walker, it could be anything, but they call it shopping cart syndrome.
Right. Yeah.
So.
Any flexion forward opens it up a little bit.
So if you answer those questions, yes, all 3, there's a really good chance you have spinal stenosis.
But on the other hand, it's nothing that's going to debilitate you.
Debilitate
your, it's kind of like getting gray hair, I tell
right,
some of
it's part of life. So,
right.
And now we're going to go ahead and show you the 30-second test you can do.
Sure.
So what you're going to do is you just have the person stand. Do you want to do it, Brad?
Sure, yeah.
You want you face the other direction. So I'm going to have you put your hands overhead like that, and I just want you to lean back like that. Now, if that increases your pain and maybe even sends pain down your leg, there's a good chance you have spinal stenosis. I mean, that's one sign.
How long do you need to stay extended?
I'm sure you'd start to feel it after a while. Well, do you feel it on yours?
No, not right now.
Okay.
But usually 30 seconds. Was that the test? Yeah.
If that does bother you, I want you to try one other thing. Let's say you do that and that causes pain down the left leg. I'm going to show you how the hip flexors or the muscles on the hips pull on the pelvis and can actually make things worse.
Sure.
So a lot of times what we have people do, we do the test, Yeah, that hurts. It hurts my left leg. Now you move the left leg forward, which puts the hip flexor on slack. That's the word I was looking for. And now you do it again. You go, well, that time it didn't hurt,
Or maybe not as much.
or maybe not as much. So that you know now that the hip flexor probably plays a little bit of role. It needs to be stretched out.
Sure.
And we'll show that in another video.
Okay.
But the other test you can do then is actually put the hip flexor, the leg back like this. Now you're stretching the hip flexor more.
Okay.
And now do it. It's like, oh yeah, that's worse.
Sure.
So just these little simple tests. I hope that's easy enough to follow. But either way, you can just do the 3 questions and just go back like this.
Right.
And that'll give you a pretty good indicator whether or not you have spinal stenosis.
Right.
And then you're going to want to watch our videos on how to treat them, because we're going to show you some great stretches to do that can make a big difference.
All right. Yeah, there's
what I
definitely
think.
some things you can do to improve the symptoms and get back to more of a normal life.
And remember, Brad and I can fix just about anything.
Except
A broken heart.
there you go.
We can fix spinal stenosis to some extent. We
well,
can help it.
yeah,
we can help you manage it.
it. There
Yeah.
and you never know. But one thing's for sure, I don't think it relates to the broken heart.
That's
The
right.
Spinal,
No,
no.
no,
We're not. It's not going to help.
Thanks for watching.